Hi, class. Dr. Weaver again. I'm going to go ahead and make another voiceover um, to complete our female genital urinary or female GU system um, discussion. Um, and of course, as you know, we will discuss the rest of the information, or the initial part of this presentation we'll do in class as usual. And we'll be starting with slide 31 on this one. So let me go ahead and share my desktop. Get rid of this. All right. So starting with slide 31, so this information regarding the aged or the aging woman, there are some examiner questions as well as the rationale. You can locate that information on page 736 to 737. And here we want to um, know that if we want to know if the woman is having vaginal bleeding after menopause, and of course the reason why that is important is because there should be no postmenopausal bleeding, and it will warrant a further pelvic exam. There may have to be a transvaginal ultrasonography or referral. In other words, it needs to be investigated further because of course, before menopause, a woman obviously she's menstruating and bleeding would be more or less expected. But of course, with after someone goes through menopause, there should be no bleeding whatsoever unless something is going on. And then one of the other questions is, well, let me go ahead and increase the size of that so you can see it. Is there any vaginal itching, discharge, pain with intercourse? And also if the patient is using lubricants in the way of estrogen cream, or is the patient taking vaginal tablets, all right, estrogen type of tablets. So vaginal dryness, decreased lubrication are pretty common due to the fact that the estrogen levels have diminished as the woman ages. Um, and of course, there are quite a few treatments that are available to manage this age-related condition. Also, another question is there any pressure in the genital area, loss of urine, especially when the woman coughs or sneezes, any back pain, or also constipation? And of course, this occurs with a weakened pelvic musculature and also uterine prolapse, some common issues with someone who is older. And also, if the patient is in a relationship involving sex, are aspects of sex satisfactory to the patient as well as to the partner? And this also, is there adequate privacy for a sexual relationship? All right. So again, when you read this information, make sure you look at the rationale. I can't state that enough. All right. So now we begin to turn our attention to the objective data. And so how we prepare the patient, as well as the equipment that is required, is important here. All right. So take a look at um, what is listed under the preparation. We assemble equipment before helping the patient into the position. The dorsal lithotomy position. The legs would be in stirrups and so forth. So we want to assist the patient in that position. And we should also familiarize ourselves with the vaginal speculum before the examination, kind of instill some confidence in us as a clinician, and not fumbling around with things, of course. And also take a look at page 737 for this information. Look at the equipment that is required: the gloves, lighting, speculums, um, the cotton tip applicators as well as lubricants. And of course, as far as materials for cytology, look at what is required here as well. Right. Right. So as far as positioning is very important here in order to do or perform the examination. Also, take a look at page 737. I will get you to read this information. Um, it talks about initially, and this could be a test question too. Initially, the woman should be sitting upright, right? An equal status position is important to establish trust and rapport before the vaginal examination. You know, you want them to feel like they're on your level, and that makes people feel more comfortable as opposed to that a superiority kind of relationship, if you will. Um, All right. So for the examination, the woman should be placed in the lithotomy position with the examiner sitting on a stool. And of course, the examiner is facing the private area parts of the female. Place the arms at her side or across the chest, not over the head, because this position tightens the abdominal muscles, making it a little more difficult to perform the examination. A traditional mode is to drape the patient fully, covering the stomach and the legs, but of course exposing only the vulva to view. So only expose what is necessary for the patient for better comfort. All right. And also be sure to push down the drape between the woman's legs and elevate her head so that you can see her face. Because, of course, looking at her face, she may show some signs of discomfort. Maybe the exam might be a little more painful or discomfort, for her. And so you want to be able to read what is going on and adjust your exam accordingly. All right. And this is the lithotomy position with the draping. That's a pretty good example. You can view that on page 737 as well. I thought they called this the dorsal lithotomy position. I don't know why it seems to just say lithotomy here. Maybe that's something I read somewhere else. I'm just curious. Dorsal lithotomy. Yeah, well, dorsal meaning the back. So someone is on the back. Maybe that's just an old term that was used, years ago, but it's called the lithotomy position. So let's just go with that. Um, all right, no big deal. All right, so that's what that would look like. The position that should be assumed by the patient. All right. And go ahead and take a look at this information, how we can help the patient to relax, decrease her anxiety, and also retain a sense of control by using these different measures. You certainly want the patient to empty the bladder before the examination. Of course, keep in mind if a urinalysis is needed, maybe she can provide a urinalysis at that time. The table should be positioned in a way that is not her private parts are not shown in view of if someone opens that door, people walking by will be able to see her private parts. So hopefully you're in a doctor's office that takes that into consideration. Also, to have someone in the room with her that can be in the form of a friend, family, or chaperone from the healthcare facility. And also position this person by the woman's head to maintain privacy, because you don't want, let's say, your family members looking at you. That would be rather uncomfortable. And also just go ahead and read the rest of that information as well. As I said, that is on page 738. All right, educational or mirror pelvic examination. Um, All right. So this information is also on page 738. Routine examination with some modifications in attitude, position, as well as communication. Um, So the patient, of course, is considered an active a participant here, someone who is interested in learning and in sharing decisions about her own health care. You know, it's all about patient preferences um, and whatnot. And we cannot, you know, um, we don't want that kind of a paternalistic approach or that kind of top-down power approach. We want the patient to be a part of the decision making because it is her body. So just think about that. It's about patient preferences and and what have you. The woman props herself up on one elbow or head. Table is raised. Her other hand holds a mirror between the legs above the examiner's hands, and just basically situating the mirror so that as we are teaching them, they're able to see what the examiner is showing. So the mirror works well for teaching normal anatomy and its relationship to sexual behavior. And so this is all about helping the patient to visualize what you are teaching her about. And the woman is more willing to comply with treatment when she shares in the decision-making process. Like I said, it cannot be one of those top-down authoritative approaches or that paternalistic approach, but she's a partner in the care and treatment process. Hopefully that makes sense. All right. All right. And then go ahead and take a look at this information. This is pretty much like your anatomy and whatnot. And so make sure you take a look at this information. Um, this is on page 737. All right, this is what it should look like. This is what the skin should look like. Um, skin should be even. The labia minora are darker, pink, and so forth. So just make sure you read the rest of that information. Um, Usually, when it comes to as far as this information is concerned, basically, you just want to know what the norm looks like. And if you know what the norm looks like, if you did get a test question about it, then you'll be able to know or be able to recognize the answer where it shows you that there's an abnormality or deviation from that norm. That's what that is. In terms of inspecting or assessing the external genitalia, here we are inspecting, and with the gloved hand, separate the labia majora in order to inspect. And just go ahead and read this slide here, what we are taking a look at, how things should appear. For example, the urethral opening appears stellate or slit-like, and it is midline. Take a look at this information on page 738 to 39. All right. And so all of this information just tells us what it should be. All right. And if we notice anything that deviates from that, then we know that there's a problem that needs to be reported. All right. And now we will perform some palpation of the external genitalia. All right. We're assessing the urethra and the Skene's gland. And of course, this procedure should produce no pain. If any discharge appears, we want to culture it and send that away for analysis. Also, we're taking a look at the Bartholin's gland. It talks about how to perform that procedure. And we also assess support of pelvic musculature by using various maneuvers. All right. We're palpating the perineum. Normally, it feels thick, smooth, and muscular in those patients who have not had any children. And of course, in with multiparous women, those who have had more several children, it will feel thin and also rigid. And this information can be found on page 739 to 740. All right. Now, here we're going to use the speculum, perform a speculum examination because this device helps us to view the internal structures of the female's um, genital urinary system. Of course, we need to make sure the speculum is not too big, not too small, but just the right size. It should be warm, and we can do this by running the speculum. It's a metal device. It's for you gentlemen in class, and it can be very cold, and we don't want that. It causes the patient to tense up and become more uncomfortable. I'm sure you ladies can speak to that, and so it would behoove all of us if we are performing this type of task to warm that speculum, that metal device under some warm water for more comfort. Also, lubricant should be used as well. Um, and of course, lubricant decreases pain and it may increase compliance with the procedure, especially in an older woman when the vagina atrophies because of age. As the woman ages and the estrogen levels begin to fall, atrophy is present, and of course it would make it more difficult to insert that speculum in the vagina. So a good lubricant would be good and more comfortable for the patient who would adhere to the examination. A good technique is to dedicate one hand to patient and the other to picking up equipment, and so that's a good method to perform this procedure. And of course, we inspect the vaginal wall after removing the speculum to determine if there's any abnormalities that are present. This information can be found on page 740 to 41. All right. All right, and take a look at this slide. This information can be found on page 742. And just go ahead and read this information regarding inspecting the cervix and its os. Um, Take a look at what it should look like. It talks about, well, normally cervical mucosa is pink and even, but when someone is pregnant, by the second month, it looks bluish in color. And of course, the Chadwick sign, after menopause, it is pale, which is the Chadwick sign. This is when it comes down to knowing what it should look like based on the patient's age. So this is why this information is so important to know, because if you saw this, for example, the Chadwick sign in a young woman, that should be cause for concern, right? Same way with if a woman is not really pregnant, but yet you see that it looks bluish in color, then that could be a potential issue. All right. And then just take a look at the rest of the information and what it should also look like. Again, page 742 for that information. All right, and this continues with internal genitalia inspection. We're taking a look at the cervix. So the surface is normally smooth, but cervical eversion or atropion may occur after vaginal delivery. So you can see that change after the lady has a baby. All right. And then just take a look at the rest of this information. Just kind of skim through this piece of information here. All right. As I said, if there's anything of concern as far as your quizzes or exams, I'll let you know to put more focus on certain areas. So, all right. And this is, of course, variations of the cervix. These are different things that you might see. Right, gives you a pretty good image. And then, of course, there's the infamous pap smear test. So look at the reason why this test, which is something that could be tested. Just think about those questions. Pap smear screens for cervical cancer, but not for endometrial or ovarian cancer. So I can give you a question. For example, the pap smear is used to, I can say A, assess for endometrial, B, ovarian cancer. I may even throw a fallopian tube in there. And then, of course, the correct answer, I would put those distractors. I may give you three. I'll give you three distractors, and then give you one correct answer. So, so just think about that. Ask the type of questions that you can be asked. And of course, we don't want to do this procedure when a woman is on her menstruation cycle or if a heavy infectious discharge is present. Um, Also instruct the patient not to douche, have intercourse, or put anything in the vagina 24 hours before collecting specimens, because you don't want to alter, anything of the test and whatnot, which can cause great concern, of course. And also obtain pap smears before other specimens, so you will not disrupt or remove cells. So that could be a test question. And when you think about it, that could be a good test question. What do you do first, right? So we do the pap smear first because we want access to cells undisturbed. All right. And this is how we obtain cervical tests and cultures. So just go ahead and skim through this information. It is on page 744. Take a look at that. Again, if there's anything that you need to take a look at for your assessment, your exam, I will let you guys know that. All right. These are some additional tests that can be done, as additional testing samples. The saline mount or wet preparation, spread sample of discharge onto a glass slide. The woman has a discharge, and add 1 drop of normal saline solution and a cover slip. So just take a look at that information. All right. Um, and your book should talk about, I'm not sure at the moment, but what these different tests are for. Let me see, I'm just kind of curious. Let's see, position. I thought I saw this when I was looking at it earlier. Internal. I think it should be in this table and give you an idea of why we're doing some of these tests. So this is, no, not that one. All right, yeah. So for example, the KOH preparation. So they tell you to add 1 drop of potassium hydroxide and a cover slip to a sample of discharge on a slide. And basically what this is doing is looking for Candida vaginitis. Some ladies, they have vaginal infections, especially if they're on antibiotics. It can possibly cause vaginitis, or if maybe they douche too often. Now, the saline mount or wet prep, uh, this is looking at trichomonas vaginitis. All right. Um, and then the anal culture is looking at gonorrhea, chlamydia, and those who perform anal intercourse in their relationships, if you will. And then, of course, the acetic acid wash. We are looking at possibly HPV infections, and so these are some of the reasons why these exams are actually performed, just to give you an idea. You see why it's so important to look at the rationale? Because some of these tests I'm not as familiar with. I thought the KOH would be for Candida. I think I was thinking about that. But I don't work in a woman's clinic or anything, so some of this it's just really still good to know. I'm still glad I know about it, because again, I may have to do some teaching to a woman that I may engage with in the hospital. We are talking to our patients all the time, or at least you should, and they may express some of these concerns. Anyway, so as far as specimen documentation, before we send these specimens to the lab, it does require this particular information. I would guess this would there would be like a form or sheet that this information would be placed on that document. Anyway, so take a look at page 745. This information, make sure it is on the sheet before sending it off. All right. This is the bimanual examination of the vaginal wall. And just take a look at it, kind of skim through it. You can find this information on page 746. All right, tells you what it should look like. Palpate the vaginal wall. Normally it feels smooth and has no area of induration or tenderness. So just take a look at it, and I'll let you know if this is something you need to be really, really concerned about. This is the one for the cervical, for the cervix. All right. And this tells you what the characteristics of a normal cervix should look like. It talks about the consistency, the contour, the mobility, its ability to move from side to side. Also palpating, that region as well. So just take a look at this information. This is the bimanual examination for the cervix. And this is the bimanual one for the uterus. All right. And so just take a look at it. Not anything I think you need to be too concerned about, but just get an idea of what the procedure entails. All right. Normally it feels firm and smooth with contour of fundus rounded. It softens during pregnancy, of course, all those hormones. It should be freely movable and non-tender. And of course, anything outside of that means that there is an issue. All right, pretty easy in that sense. And then the bimanual examination of the adnexa. Move both hands to the right to explore adnexa, and just take a look at that information. All right, take a look at that. So normal secretions are clear or cloudy and odorless. All right, so just take a look at that. That's on page 749 through, 748 to 49. Again, make sure you guys have your textbooks right next to you as you go through this presentation. And you can find this stuff too, just do a search of the page, which is why I like the electronic books more so than the paperback books. All right. And this is the rectovaginal examination. We use this technique in order to assess the rectovaginal septum, see if it's intact, of course, the posterior uterine wall, the cul-de-sac, and also rectum, right? Hence the term recto, the rectum and the vagina, all right? Change gloves to avoid spreading any possible infection. Lubricate first two fingers. See, all that stuff can be in an exam. So just make sure you take a look at that. Instruct the woman. This may feel uncomfortable and will mimic feelings, moving her bowels. So things that you want to, make sure the patient knows about before actually doing it, because educating the patients before procedure, it diminishes some of that anxiety. And if they go, they know what to expect, in other words. So very a good thing to do. Um, and this information is on page 749. All right. And this is just a continuation of the rectovaginal examination. All right. So take a look at that. All right. Um, Take a look at this one here. So check your gloved finger as you withdraw. Test any adherent stool for occult blood. So when you're assessing the rectum, and you have stool on your glove, I don't know. See, so you guys have gone through fundamentals 1 and currently gone through fundamentals 2, and so maybe you've had a chance to learn about the occult stool. This is where blood is in the stool, but you can't see it with the naked eye. And so hopefully they would have, or they will teach you how to do that. And basically you have these like 2 windows on a card, and you place samples on each window, and you get this blue kind of dye, or rather you get this dye, and you put a sample or drops on both windows, and it should turn blue if it's positive. Well, if it turns blue, it is positive for occult stool. So anyway, so hopefully you all will learn about that. It's called occult blood. It's an occult blood test, but I think it's called something else. Let's see. All right, and here we have the developmental competence as far as infants and children. Um, This one just tells you about whether it's an infant, a toddler slash preschooler, a school-age child, and how they should be placed. For example, you place an infant on the examination table, but a toddler or preschooler, you want to place them in the parent's lap. So just take a look at that. I mean, you might be asked what is the appropriate, how should a child be examined, in what way, of course, and so just think about that. Right. And check this part out. As far as toddler preschool, no drapes. So that would be important. Young girl wants to see what you are doing. Right. School-age child is placed on an examination table, frog leg position, no drapes. So those are really good things to know. Right. But during childhood, routine screening limited to inspection of external genitalia to determine if the structures are intact, vagina is present, and also the hymen is patent. And I think your book also gives some examples of what that would look like. Right. As far as newborns are concerned, the genitalia are somewhat engorged, um, but it does resolve, and I believe that's due to more of these hormones and how they cross the placenta and causes this to happen in children, in your girls. Um, so the labia majora is swollen. The labia minora is prominent and protrude beyond the labia majora. The clitoris looks relatively large, and the hymen appears thick. So just know that that information, so that you know what it should look like. Um, Check this part out. A sanguineous vaginal discharge, or leukorrhea, or mucoid discharge is normal during the first few weeks due to maternal estrogen. So those hormones has a lot to do with some of the things you're seeing. May also cause transient breast engorgement and secretions. we're talking about the hormones that causes this. Normally, no irritation or foul-smelling discharge is present. So those are things to think about with the newborn. As far as the school age child, take a look at this information, all right? All right. An external examination will probably suffice for those in this age group. Normally, the hymen is, let's see, the hymen is perforate. I'm not sure what they mean by that. I guess there's a hole in the hymen. It shouldn't be like a wall, if you will. Um, yeah, I'm not quite sure about that one. As I told you guys, this is not my, this is a school age, not my area of expertise, but I'm curious about that one. Curious. Um, Perforate. I'm thinking imperforate. So it's imperforate hymen, or yeah, imperforate hymen warrants a referral. So in other words, it has been in other words, somebody that there's probably been some penetration that has broken the hymen. All right. Because remember, that's one of the ways you can tell if a female is a virgin, right? Once that is removed, then you know that there's been some kind of penetration. Um, let's see, it says push laterally while pushing the perineum down and try to note the vaginal opening above the hymen ring. All right. And an imperforate hymen warrants further referral. It could be some molestation if you think about it in that sense. They said the normally hymen is perforate, but actually imperforate. Let me make a correction on that. Um, yeah. Uh, so what is imperforate hymen? All right, so it's a half moon of thin membrane normally surrounds the opening of a young girl's vagina. In the case of an imperforate hymen, a membrane extends all the way across the area of the hymen, blocking the vaginal opening. It's easily corrected through a minor surgery. So this doesn't always mean that someone has been violated, but again, it certainly means that you know um, it warrants further investigation. Um, Now, of course, here it says, yeah, so imperforate. Yeah. So if it's imperforated, then yeah, make your referral. Um, all right. So I won't spend too much time on that. Let's see. So now we're looking at the adolescent. So check this part out. So examine her alone without the mother present. Now that may be counterintuitive for some of us because we feel like I'm the grown up, that's my daughter, and I want to be in the room. But at the adolescent age, uh, not the same, right? You can't do that. There should be privacy and confidentiality. And of course, this is plenty of time for the nurse to provide some health education and discuss pubertal progress with the patient, even at Tanner's staging tool that we use. All right, and just take a look at the rest of this information. Yeah, stuff like this can be on your test as well. It may say the proper way to assess an adolescent, or they may give you an age, which is someone with, let's say, 14, which is adolescence. Then they may give you rather a question about is it appropriate, what is the appropriate way to assess this patient? And one of them is the girl's parent a mother's in the room, and of course, not to select that particular one. Again, just think about how these test questions may be presented to you. And you can get a lot of that through reading. Continuing with the adolescent, perform pelvic examination when history suggests indication. All right, so there can be something in the what is being reported to the healthcare provider that would warrant a pelvic examination. Otherwise, you might be able to get away with not actually performing it. Start periodic pap smears when intercourse begins. So once the patient becomes sexually active, then the pap smear should be started. Um, and check this part out. So, of course, if you're dealing with an adolescent, you would need to provide additional time. More time would be warranted, and psychological support for adolescent having her first pelvic examination. Really important. I mean, this is a child, right? An experienced adult, not as much, but with a child, just be a little more sensitive. This information, of course, can be found on page 751. And of course, as it mentions here, first pelvic examination experience determines how adolescents will approach future care. So if it's done in a way that is not that is too aggressive, perhaps not as sensitive, if you will, then this child may not ever want to have one again. So be considerate, build trust, and what have you. Then take a look at the pregnant woman as far as developmental competence. Read this information on page 752. All right, and so depending on how far along the patient is, week of gestation will determine how large the abdomen will be, of course. The height of the fundus ascends gradually as the fetus grows, of course, and they use the tape a measure to get that information. External genitalia show up hyperemia, perineum, and vulva because of increased vascularity. So you'll see a little more redness, if you will, in that area. And during the bimanual examination, the isthmus of uterus feels softer and is more easily compressed between your fingers, which is the Hager sign. Again, just think about all those hormones and how it's affecting the body. All right. And then, of course, we look at the age. These are the folks that we will likely see, at least in the hospital, acute care setting. All right. Of course, we want to avoid painful examination, always using lubricants. Um, um, when we are examining these patients. Um, use Peterson speculum rather than Graves. Of course, that's pretty specific. So if you work in that area, I'm pretty sure those are things you'll be trained to do. Because it's narrower. Well, this is why, because these tools, this tool is more narrow, and of course the flatter blades are more comfortable. So you're just trying to make the patient more comfortable, especially if she has a vaginal stenosis, like the vagina is much more narrow or dry. And so, all right. And so internally, the rug of the vaginal walls decrease, um, and the walls look pale pink because of thin epithelium. So you will see those age-related changes in your patient. Um, Developmental. Hold it. I just wanted to see something. I don't know why I don't do this. Before. It's about something. Okay. All right. So I wanted to look at that word again because it just kind of came out wrong. But So internal, this is rugae of the vagina walls, decreases. So it looks more, I guess it will have a more of a smoother look as opposed to the kind of wrinkle. Well, wrinkle may not be the best way to describe that, but they look like folds, more like folds. They're not really smooth or even, if you will. Um, but the mucosa just looks quite different, you know. And just take a look at what that should look like. Well, in the age, you'll see the pale pink. It's pale pink because of the thin epithelium. The cervix shrinks and it looks more pale and glistening. And of course, just look at the other information. Older women may have special needs and will appreciate following plans of care. So consider that with the aged as well. All right. Of course, this is our health promotion. You have to, of course, understand the disease process or these conditions in order to be a good teacher. Now, with this particular section, there are some talking points and that your book talks about, but it also talks about some conversation openers, how you can actually uh, 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 verbalize or word in your discussions with the patient to make it easier to assess these health potential health concerns. And so that can be found starting on page 753. So just take a look at that. You'll be talking about crabs, herpes, syphilic chancre, contact dermatitis, HPV warts, urethritis, abscess of the Bartholin's gland, which can be fairly common. And so just take a look at that list and the different questions. Um, I was just curious. Um, where's the health promotion? Uh, I think I might be on. Yeah, I think I'm beyond where. What did I say? Page 753. Yeah. Um, I'm gonna look at the header. Mm, pregnant women, the aged. Yeah. Well, this one just seems to give you a description of what to expect when, as far as the health promotion piece of it. Some of it, it does give you, well, no, I think that talking points. I don't know why I don't see that anymore. I thought I saw that initially about the different talking points. Oh, maybe it's down a little further for the age. I think I was in the adolescence. Um, but maybe not. Maybe I thought I saw it. I was looking at perhaps something else. Uh, no. Well, scratch that as far as talking points for the aged. This is more for adolescents. So excuse me for that. As far as talking points stuff, for example, if you're talking about HPV vaccination with the complete series, you can say something like, have you started the HPV vaccine series? Did you finish the second, did you finish the 2 doses, 3 doses? And of course, this protects you against cervical, you can tell the patient rather, this protects you from cervical cancer and other cancers caused by the HPV or that particular virus. And for example, another example, if you're talking about preparation for possible sexual activity, are you dating anyone, someone special, and the rest of that information. This would be as far as external genitalia abnormalities. Your book does show you some really good examples of what that would look like, and so don't know if I got the right page numbers for you off of that one. External genitalia. It says 756. Let me see if I got the, all right, so I need, all right, so that is correct. All right, yeah, so I had it right. So for the adolescent, excuse me for sounding so confused. I'm just trying to see where I am. So the for the adolescent, the health promotion teaching, I did talk about the teaching, the talking points, and the conversation openers. So that is correct. But on slide 62, where it begins to talk about these various external genitalia abnormalities, you can find that information on page 755. And let me see if that's really the case. This book kind of doesn't show me the actual page numbers all the time. It's like it jumps or something on me. But yeah, there's some pretty good, let me show you some pretty good examples of that. Yeah. So let's see, 756. Yeah, here. So it talks about the crab lice, what that looks like, the herpes simplex. Talks about the syphilitic chancre, the contact dermatitis, the HPV, the abscess on the Bartholin's gland, and so forth. So all that's pretty good. Also, it provides you with the subjective findings, what the patient would tell you, and then of course the objective findings if you want to take a look at that. Of course, with the exam, I will let you know what to really focus on because that's quite a bit of a list to look at. All right. All right. And on slide 63, these are abnormalities with the pelvic musculature, the cystocele, rectocele, uterine prolapse. You'll see that mostly in your older population because as you get older, the musculature does change. It becomes weaker. That's why some people or some women they do the Kegel type of exercises to hopefully help with some of that. But some things might be inevitable just due to age. This information, it also provides subjective and objective findings that you can look at starting on page 756. Also, information about the cervix and all of the abnormalities that might be discovered. You can find that also starting on page 756 as well. Let me make sure. Let's see, pelvic musculature, that's 756. Cystocele, uterine, rectocele, and yeah, so all that is starting on page 756. That's a lot on page 756. That's what made me kind of dubious about what I was telling you. And then of course, oh, all right. So on slide 64, you have your vaginal inflammation, the atrophic vaginitis, candidiasis, or fungal infection, trichomonas, and so forth. You have the pediatric genitalia and the couple of issues listed there. And that is also on page 756. And it also provides some subjective and objective findings as well. So take a look at that. And then we have enlargement of these enlargement of the adrenal or adenoid enlargement, which consists of like your fallopian tubes or ovaries and so forth. And you also have uterine enlargement as well. So just take a look at these um, different items here on this page. And again, this is quite a bit of a list, and I will let you guys know if there's something to be more focused. There should be a greater focus. And then, of course, this is the summary checklist, how we sum everything up. We're inspecting the external genitalia, palpating the labia and the Skene's and Bartholin's gland, using the vaginal speculum, looking at the cervix as well as the vagina. We're also obtaining specimens for cytology studies and analysis. We're performing the different bimanual examinations, which involve the cervix, uterus, as well as the anexa. And we also perform rectovaginal examinations, which would involve, of course, testing stool, since the rectum is a part of that exam, for occult blood. And crazy enough, that information is on page 756 as well. Just don't know if, because I'm looking down at my book at the numbers, at the pages, and seeing if it changes, and it doesn't change. So I suppose it is on those pages. And so, I mean, you can go through your book and find this information. Actually, let's see. Yes, on page 756 as well. Very strange. Show you all what I'm talking about. It just seems to seem like it would change because it's quite a bit of information. So see, I'm clicking on this area where the summary checklist is, but if you come down here where it says 756, yeah, I kind of 756 through a lot of different images here, and so I suppose that's in the right place. Hopefully that corresponds with your textbook as well. But again, you should be able to find the information because I follow the outline from the textbook. All right. So that is about it. That would conclude, rather, this particular presentation. This would be just for the female, and of course, I have to do one for the male as well, which I'll probably do that next week sometime. All right, folks, I appreciate you guys taking a listen to this information, and I'll go ahead and get this uploaded, and hopefully you all will find it useful. Thank you all.